get started. I am Barry Johnson with the County Welfare Directors Association, and I am very excited to introduce our speakers from Chapin Hall, Clare Anderson and Yasmin Grewal-Kök. We know that there is ample research that shows the importance and significance of concrete supports and economic supports in preventing child maltreatment. And one of the reasons why I know that is because of these folks. So they have done a tremendous amount of work and research in this area, and we're really excited to have them. A couple of housekeeping things. There's a lot of folks on here. We encourage you to put your questions in the chat, and they will designate some time at the end to go through the questions, lift up any themes, and hopefully answer them. So as they're presenting, go ahead. We'll monitor the chat, and then we'll have some time at the end. So with that, why don't I introduce Clare and Yasmin?
Hi, I'm Clare Anderson. I'm a senior policy fellow at Chapin Hall, and just more than delighted to be with you here today.
Hi, everyone. I'm also delighted to be here. I'm Yasmin Grewal-Kök, policy fellow at Chapin Hall.
All right, why don't we get started? I am going to share my screen, which will take me just a second to get it up, and then over to viewing the slide deck. So I'm going to play from the start here. Fantastic. As Barry indicated, we're going to talk to you today about the evidence of economic and concrete support as a core component of a child and family well-being system, and as a core component of prevention, as you all are working on prevention plans, prevention strategies, prevention partnerships. We hope that there is something here to inform your thinking and your action and your policy and practice framework. So we're going to try and bring to you about 40, maybe 50 years of evidence. And this slide sums it all up. So this is the big takeaway. We have about 40 to 50 years of evidence suggesting that economic and concrete supports are a relatively powerful tool in prevention. When families have reduced access to economic and concrete supports through a variety of mechanisms, job loss, an income shock, medical bills that they can't pay, there is an increased risk of involvement with the child welfare system. But when economic and concrete supports are increased, there is a reduced risk of involvement with child welfare and child maltreatment. We see this across a number of different mechanisms. So whether it's cash assistance, childcare, housing, healthcare, employment supports, we see these different kinds of effects. And so we're going to spend a lot of time talking with you today about the evidence, hopefully so that you can make it actionable through your prevention strategies, policies, and plans. We'll start out with just an overview of economic insecurity, income, and child welfare system involvement. We know that about 60% of substantiated investigations nationally involve neglect only. And we know that there's a lot of different things in the box of neglect. We see substance use, mental health challenges, domestic violence. Many things come under this word neglect that we use. But we'll see that economic and concrete supports seem to be having an effect regardless of what's in the box, though we don't have enormous science on when and under what circumstances economic and concrete supports seem to have this effect. But we do know that it is pretty durable and reliable over time, as you'll see in the variety of studies that we'll share with you today. We also understand, this is very important, nearly 85% of the families who are investigated by CPS have incomes below 200% of the poverty line. We have lots of hypotheses about this. Certainly, we can see in this data that families with more means who have substance use, domestic violence, and mental health challenges don't seem to come to the attention of child welfare. Perhaps their resources are buffering the anxiety or the problems in the household that relate to child abuse and neglect and involvement with child welfare. So certainly, I think the multitude of ways that we can understand how and when we are appointing child protective services, it is predominantly to families who have very limited means. In California, 54% of child welfare involved families earn less than $1,000 a month. We also know that the relationship between poverty and CPS reporting has intensified over time. We've seen it increase by about 40% between 2009 and 2018. The authors of this particular study suggest that we need to build policies and practices that reduce the level of economic hardships for families in general as a prevention strategy, and reorient human services to recognize the core and expanding importance as poverty is a fundamental threat to human functioning. That we should really support an increased emphasis on reducing child maltreatment incidents and reports through poverty amelioration and the provision of material family supports. This is one of our favorite studies. I think it helps us see this dynamic very clearly. Families who are low income, this is a population of families receiving TANF, temporary assistance to needy families, who experience one material hardship, at least one, are 3 times higher likelihood of a neglect investigation and 4 times higher likelihood of a physical abuse investigation. But if low income families experience multiple material hardships, their risk increases exponentially. We see an almost 7 times higher likelihood of a physical abuse investigation. So we know that economic and concrete support seem to be having an effect on both neglect and abuse as well. It's not part of how we currently understand it or even talk about it. We talk a lot about conflating poverty and neglect, but we've got to be really nuanced in our understanding of these shocks, income shocks, material hardships, and the effect on both neglect and abuse. We are getting better at understanding what the predictors are. And if we get better at understanding predictors of involvement with child welfare, we can get better at identifying those things that are happening in families much earlier than we currently do. On the right-hand side in the dark blue, the strongest predictors of investigated neglect reports are things like food pantry use and cutting meals, so food insecurity, housing insecurity, utility shutoffs, and the inability to pay for medical care for a sick family member. You'll see throughout this presentation that public benefit receipt, while can be a predictor, is also highly buffering or protective. So we think maybe here in this particular study, they're picking up on a spotlight effect. Many people in human services seeing families and making more referrals. On the left-hand side in the lighter blue, the most reliable economic predictors of child welfare system involvement are income loss, cumulative material hardship, and housing hardship. So this begins to home in a little bit closer to child welfare. So this is a study looking at closed CPS investigations, the families already being investigated. Those families that experience a negative earning shock, their risk of a subsequent CPS investigation increases by 18%, and a physical abuse investigation risk increases by 26%. And each additional negative earning shock is associated with a 15% greater likelihood of CPS involvement. I guess it's studies like this that help me sort of like turn the kaleidoscope a little bit and ask, is this child abuse and neglect, or are our words even sufficient for this? Are these experiences that our families having when their resources are constrained and their ability to manage has been swamped or overcome by these exogenous factors. Because we also see that for low-income families who have a recently closed CPS investigation, each consecutive quarter with a stable income is associated with a 5% lower risk of a CPS investigation. And importantly for the babies, which we know come to the attention of child welfare more than all other kids and are in foster care more than other kids as well, those kids under 5. Accessing sufficient public benefits when negative earning shocks occur effectively buffers against the risk of child welfare involvement. And we see a particularly strong buffer for families with young children, where we see an associated 50% decrease in risk for a physical abuse investigation. Okay, so let's talk about context a little bit more and the drivers of family economic insecurity and where we think there might be a nexus with child welfare system involvement. We'll start just with a theoretical model because it's always a good idea to do so. The family stress model is very informative in this regard. We see economic and material hardship and psychological distress, high cognitive loads, drained mental resources, leading to increased conflict and hostility, less nurturing relationships and supportive parenting, and a higher risk of child welfare system involvement. Really sort of being overcome by these factors that are happening to a family or within a family, secondary to economic and material hardship that is increasing, we believe, risk of involvement with child welfare and child maltreatment. While that might be true, that family stress model, it is important to understand that economic factors are associated with neglect outcomes above individual level parenting behaviors and capacities. I think we've all, well, I'll speak for myself. For many years, I conceptualized child maltreatment as a parenting problem or a parenting capacity problem. But I think the science is helping us to understand this in a far more nuanced way that helps us take action in terms of addressing these drivers. Because we also see here that material hardship is associated with CPS involvement beyond caregiver psychological distress and parenting factors. And these associations with child maltreatment is reduced after accounting for poverty experienced by families receiving preservation services. When the effects of poverty are accounted for, we quote the authors, these individual factors lose their potency. So I've talked about getting swamped or overcome by these factors. We also like to talk about this as really becoming overloaded. These boxes represent the predictors that I talked about in an earlier slide: housing hardship, food insecurity, income loss. If you put 500 pounds of those boxes on a truck that has a payload of 4,000 pounds, the truck, the parenting, the familial interactions, they don't work as intended because they have been overloaded with burden that our prevention efforts can address. We see being able to address these factors very clearly in the Jessica Pack simulation that came out last year. Jessica Pack and her colleagues took the National Academy of Sciences consensus report on reducing child poverty, where there were 4 packages of public resources and benefits that could reduce child poverty by 50%. This simulation took each of those packages and modeled them with CPS investigations and found, depending on the package chosen, CPS investigations could be reduced by 11 to 20% annually. That's up to 669 fewer children being investigated per year. And the effect was particularly strong for Black children. So this analysis suggests that implementation could substantially reduce racial disproportionality with CPS involvement, those investigations. We see that 11 to 20% increasing to a reduction between 19 and 29% for investigations for Black children. Well, why is this important? Ladies and gentlemen, over half of all Black children will experience a CPS investigation by the time they turn 18. And almost 40% of all children will experience an investigation by the time they turn 18. I don't think that is what was intended when our child protection system was developed, that it would be pointed at the majority of the over half of all Black children and nearly 40% of all children. We also think that the wealth gap between white families and Black families, or Black families and all other families, is also putting undue or unusual kind of stressors in the lives of families, particularly those in the lower quartile of earnings. We see that in 2022, the median wealth by race increased for all groups. But we also see that the gap between white families and Black families grew. The median wealth of a typical white family is about $285,000 a year, while, I'm sorry, not per year, it's the wealth. While the median wealth of a typical Black family is about $44,000. So in California, what's the reach of CPS? We saw in the previous slide, it's about 53% for all Black children at the national level. In California, Black and Native American children experience the CPS involvement at more than 2 times the rate of white children, and approximately half of all Black children, a slightly less percentage, 46.8%, and Native American children at 50.2% are investigated at least once by CPS. The Legislative Affairs Office in California, in a recent analysis and set of key questions around reducing racial disproportionality and disparities in California's child welfare system, stated that racial disproportionalities and disparities persist across the child welfare continuum and have not changed dramatically over the past decade. We need new strategies or new resources or new ways to think about disparity and disproportionality and preventing them. And over the past decade, it found that more than 80% of California's youth in care at any given time were placed due to neglect. California is making really important changes. AB 2085 in 2022 narrowed the definition and limited neglect for the purposes of mandated reporting, and stated only includes circumstances where the child is at substantial risk of suffering serious physical harm, and excludes a parent's economic disadvantage, while SB 1085 prohibits children from being removed solely due to a family homelessness or poverty, including the inability to provide clothing, home repair, or childcare. Not surprisingly, parents who have been engaged with child protection in the child welfare system have ideas about how to organize prevention. This very wonderful and elegant logic model that they created, the Birth Parent National Network and KC Family Programs Birth Parent Advisory Committee, in partnership with the Children's Trust Alliance, stated, we share our lived experiences and perspectives with national, state, and community leaders, that's us, to transform child welfare system and to raise awareness about the need for increased prevention strategies and resources for families before serious problems occur. And while this type is very small, the big takeaway here is that families kind of all along have known that federal laws and policies are needed to redress child and family poverty, meet children's basic needs, and increase supports for family policies like paid family leave, earned income tax credit, affordable housing, and insurance that covers medical, dental, and vision. And that we need strategies and methods that help families build and sustain food, housing, education, childcare, transportation, healthcare, job opportunities, and social supports. And in a moment, Yasmin is going to talk about each of those kinds of supports and the evidence, the more quantitative evidence to support families' qualitative lived experience and expertise. We also asked child welfare leaders what they think about economic and concrete supports. Chapin Hall just released the first national landscape survey of child welfare leaders regarding economic and concrete supports. And child welfare leaders across the country confirm that economic need frequently contributes to child welfare system involvement, and that more direct and flexible funds at the federal level and at the state level are needed to meet the economic and support needs of families. Policies and practices that contribute to unnecessary child welfare involvement should be revised, including mandated reporting laws, definitions of child maltreatment. And there's a need for a cross-sector shared responsibility and accountability framework that supports prevention and preventing the activation and deployment of child protective services and the use of foster care. This is my last slide, and I'm going to turn it over to Yasmin. We also want to just highlight the National Academy of Sciences, Engineering, and Medicine recently convened a consensus committee to present findings to the nation regarding reducing intergenerational poverty. And they found that reducing child abuse and neglect and child maltreatment and involvement with child welfare would be a strategy for reducing intergenerational poverty. And they had some very interesting findings. Causal evidence on factors leading to child maltreatment and child welfare involvement is limited, although most evidence points to household economic hardship as elevating the risk of child welfare involvement, and to income support and income support policies reducing risk for child welfare involvement, with the most consistent evidence of causal effects on reduced child maltreatment is for direct income transfers to low-income families, as well as other support policies like Medicaid, SNAP, WIC, and we'll see a few more that Yasmin will talk to us about.
All right, let's talk now about what the evidence tells us about the relationship between economic and concrete supports and child welfare involvement. I want to talk briefly about the sources of evidence included in our presentation today. We have to be careful about making generalized interpretations from this body of research, since each of the studies that we share has different limitations. There are only a handful of studies that are randomized controlled trials, which are considered the gold standard of evidence because they can assess the causal impact of interventions. So most of the research that we're going to talk about today demonstrates associations and correlations, but not a causal impact. This means that other factors may play a role in the results. Several studies in our deck, let's go back for one more second, are based on observations using decades of administrative data aligned with policy shifts. Other studies are based on natural experiments that assess public benefit programs when there were changes in policies, such as when there were stricter requirements implemented for TANF eligibility or expansion of healthcare through the Affordable Care Act. These studies shouldn't be considered in isolation. Rather, taken together, we think this body of science expands our understanding of what has been effective and why, and informs potential policy shifts and new pathways. All right, let's go to the next slide. So based on the research that we've compiled at Chapin Hall, this slide provides an overview of the types of economic and concrete supports that, when decreased, are associated with increased risk for child welfare involvement. This includes reduced TANF benefits, lack of childcare and stable housing, reduced employment and income, and increased gas prices, meaning less disposable income available for families. And here is a summary of the types of economic and concrete supports that, when increased, are associated with decreased risk for child welfare involvement based on the research we've compiled. They fall into four main categories: macroeconomic supports, concrete supports, public benefits, and child welfare interventions augmented with economic and concrete supports. I'll share findings from a few of these key studies today. This important analysis looked at state spending on public benefit programs, including cash assistance, housing supports, childcare, refundable EITC, and Medicaid. It found that each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with a 4% reduction in child maltreatment reports, 4% reduction in substantiations, a 2% reduction in foster care placements, and an almost 8% reduction in child fatalities due to maltreatment. These findings suggest that state investments in public benefit programs are a population-level strategy to prevent child welfare involvement. The analysis also found significant long-term cost savings from this investment. You can see that in the small box at the bottom of this slide. Each additional 13% that states spend annually on public benefit programs would save up to $153 billion due to reduced child maltreatment-related costs. The LAO report that Claire shared in a previous slide cites research that finds poverty and economic stressors create conditions in which child maltreatment is more likely to occur. And it cites the analysis I just shared on the previous slide that finds a relationship between increased state spending on public benefit programs and decreased child maltreatment. Based on this research, the LAO concludes that overall spending on poverty alleviation and prevention could be a component of reducing child maltreatment, and recommends the following policy option considerations. What support could the legislature consider to target disproportionately impact communities prior to child welfare involvement? And how can the legislature help ensure poverty alleviation programs and child welfare supports are complementary? Let's go to the next slide. This recent working paper analysis found that on average, an additional $1,000 unconditional cash payment to families in the early months of a child's life is estimated to reduce the likelihood of a CPS referral for neglect by 10% by the time the child reaches age 3, a CPS referral for physical abuse by 30% by the time a child reaches age 3, a substantiated CPS referral by 15% by the time the child reaches age 3, and child mortality by 30% by the time the child reaches age 5. Go to the next slide. There's a growing body of evidence showing that tax credits are associated with decreased risk for child welfare involvement. This study found that EITC and child tax credit payments are associated with immediate reductions in state-level child maltreatment reports. Each additional $1,000 in per-child EITC and CTC tax refunds is associated with a decline in state-level child maltreatment reports of 2.3% in the week of payment and almost 8% in the 4 weeks after payment. And the authors hypothesize that that larger decline in the 4 weeks after payment may be related to the length of time it takes for families to resolve debts or other financial burdens after they receive these tax credit funds. Let's turn next to a study that focuses on California. So this study looked at state-level data from 1995 to 2011 on the population rate of hospital admissions due to abusive head trauma in California before and after its 2004 paid family leave policy went into effect, and compared that to 7 states with no paid family leave policy. It found that California's policy was associated with a significant decrease in hospital admissions for abusive head trauma among children under 1 year old and among children under 2 years old. Next slide. There's also a body of research on the relationship between access to childcare and childcare assistance and child welfare involvement. In this study, each additional month that mothers who are low income receive a child care subsidy is associated with a 16% decrease in the odds of a neglect report and a 14% decrease in the odds of a physical abuse report in the following 12 months. Next slide. Let's now consider the potential impact of universal home visiting. There are several studies on the Family Connects model, which is a community-wide nurse home visiting program for families with newborns. It's short-term and it focuses on assessing family material needs and then connecting families to needed community resources. Studies of all families with births in selected hospitals in Durham, North Carolina over a 6-month period found that families who were randomly assigned to receive Family Connects experienced more positive maternal mental health, a 44% lower rate of CPS investigations through the time their child reached age 2, and 39% fewer CPS investigations through the time their child reached age 5. These findings suggest that when implemented with high quality and broad reach, a short-term home visiting program has the potential to reduce population rates of child maltreatment. Next slide. Providing economic and concrete supports to families participating in home visiting programs is an important policy option for states and jurisdictions to consider. In 2022, California increased the amount from $500 to $1,000 for a one-time payment for the purchase of material goods for families participating in the CalWORKS home visiting programs. Next slide. This is a particularly interesting study. It used the inconsistent adoption of the Affordable Care Act across states as a natural experiment to explore how policies that improve parental access to healthcare are associated with reduced rates of screened-in referrals for children under 6 years old. Specifically, this study found that between 2013 and 2016, the rate of screened-in neglect referrals decreased in the 31 states that expanded Medicaid, but actually increased in the 19 states that did not expand Medicaid. Based on this analysis, the authors estimated that if the 19 non-expansion states had expanded Medicaid, there would have been an estimated almost 125,000 fewer screened-in neglect referrals for children under age 6 in the US from 2014 to 2016. The authors suggest that the increased financial stability in households and improved mental health of adults, both of which have been associated with Medicaid expansion, may contribute to a reduction in maltreatment of young children. Next slide. Next, I want to turn to studies on housing supports. This is a study by my colleagues at Chapin Hall. It's a randomized controlled trial that assessed the impact of a supportive housing intervention for child welfare-involved families in Connecticut who faced housing instability. Families randomly assigned to the intervention group received a housing voucher and case management services, while families in the control group received the business as usual services. This study found that compared to the control group, families who received supportive housing experienced significantly fewer removals, a lower prevalence of substantiated maltreatment, and increased reunification. The Department of Housing and Urban Development's Family Options Study was a multi-state randomized controlled trial, which found that at the 20-month follow-up, the homeless families who were referred to permanent housing self-reported 50% fewer foster care placements in the last 12 months compared to the business as usual control group, as well as lower rates of psychological distress, intimate partner violence, housing instability, and food security. Next slide. There's also an ever-growing body of evidence on the relationship between increased access to TANF and reduced child welfare involvement. This study from 2022 examined the effect of state policy choices that restrict access to TANF benefits for families. The policies considered in this study included time limits, sanctions, work requirements, and suspicion-based drug testing of applicants. It found that easing these TANF restrictions is associated with fewer children with substantiated neglect and fewer children placed into foster care. And it estimated that around 29,000 fewer children would have entered foster care nationally from 2014 to 2016 if states had eased TANF restrictions to increase access for families. Next slide. As with TANF, states have considerable flexibility to establish policies that make SNAP benefits more accessible to families. We're starting to see more research on the impact of SNAP on child welfare involvement. And this study highlights the important relationship between more generous state SNAP policies and reduced risk for child welfare involvement. It found that states that had more generous SNAP policies experienced large reductions in CPS reports, fewer substantiated reports, particularly for neglect, and fewer foster care placements. Now I'm going to turn back to Claire to talk about the research on economic supports and improved mental health and well-being.
So let's talk about mental health improvements and well-being as it relates to economic and concrete supports. We know, or we see in these studies, that living with low income is associated with increased risk for poor mental health. Low-income mothers with young children are particularly at risk of depression. Studies estimate between 16 and 48% of low-income mothers with young children have clinically significant depression. But we also see through longitudinal studies that material hardship in particular is associated with and comes before poor mental health. Among low-income mothers with a young child, experiencing material hardship in the last 12 months is associated with an increased risk for depression. For these mothers, the risk of depression increases with the greater number of material hardships reported. So if we're connecting dots here between mental health challenges and CPS involvement, we can't also not understand the contributing factors of material hardships and economic shocks in the lives of families to understand how and why families come to the attention of Child Protective Services. Stanford, the Center on Early Childhood, and its rapid survey has helped us to understand this connection empirically. During the pandemic, it surveyed families with young children to understand how income shocks and the benefits that were being made available were having an effect on the lives of families. And they found evidence that demonstrates a chain reaction of hardship in which material hardship is directly associated with an increase in parents' emotional distress, including depression, anxiety, loneliness, and stress symptoms, which in turn is then associated with an increase in child emotional distress, fussiness, fearfulness, and anxiety. And you'll remember back early on, I shared a slide that showed us the family stress model, whereby economic and concrete hardship can lead to drained cognitive load or a higher cognitive load, drained mental resources, higher emotional challenges, and conflict in the household. So we're starting to see empirically how this works to lead to involvement with child welfare system involvement. It looked particularly at families in California and found that half of parents in California with young children were having difficulty paying for basic needs 75% of parents surveyed reported experiences in emotional distress, and 75% of parents reported that their children were experiencing emotional distress. So this is a really important, I think, groundbreaking set of surveys and data that we have available, particularly in California, to understand the mechanistic pathway by which families are experiencing hardship, increasing emotional distress on the part of the parent and increased distress on the part of the child. We see that the Earned Income Tax Credit of 1993, which expanded EITC, found that this benefit level for families with 2 or more children, mothers with a high school degree or lower who were eligible for EITC and had 2 or more children, self-reported larger improvements in mental health and reductions in stress-related biomarkers compared to similar mothers with only 1 child. So multiple children in the household, economic and concrete, well, this economic support seemed to have a particular effect. And we see through the Canadian child tax benefit expansion that it was associated with reduced depression for mothers who are low income. I think this is a particularly interesting study analysis, and in the context of developing a county level prevention plan, I think has particular salience. This analysis found that mothers who received the Women, Infants, and Children benefit in counties with greater amounts of per child spending on prevention had lower odds of an individual child maltreatment investigation. And those prevention services that were being purchased or invested in at the county level are in the blue box. And this effect of county prevention spending on individual maltreatment investigation was irrespective of whether or not a particular family actually received the prevention service. So there seems to be some synergy that happens when a county is investing in prevention services, even if a particular family does not access one particular service. It's important to understand spending or investments in prevention services relative to the costs, the lifetime incurred costs of child maltreatment in the United States. We have a couple of studies that help us to see this very well. We see about $80 billion in direct and indirect costs of child maltreatment and $563 billion economic burden associated with child maltreatment for 2018. It's a cohort of children nationally from 2018 with substantiated cases of child abuse and neglect. And that cohort as a whole will collectively incur lifetime costs of nearly $563 billion over their life course. We also see almost $3 trillion in economic burden associated with investigated cases of child maltreatment. This was also a cohort looking at 2018 that will collectively incur costs over their lifetime. So the amount of money on the downstream is enormous. And I think what you all and all of us are trying to accomplish is to understand how might resources provided earlier to families or made available to families or stabilized employment or income could have in the life course set of costs and avoiding those costs. This last study, Grewal-Kök study, also looks at state spending in California, as well as safe and sound and child trends. We see safe and sound estimating up to about $284 billion, estimated total annual economic burden incurred by California communities due to child maltreatment, again, based on cumulative lifetime costs, and at least 3.1 billion in annual public expenditures on California's child welfare system specifically. So those dollars coming to and through the child welfare system. And of its federal expenditures, California is not an outlier. We see them spending pretty much consistent with other states, but still far more on the intervention side than on the prevention side, with about 53% of spending of state and federal dollars through the Child Welfare Agency on out-of-home placements, and only about 11% on prevention services. But we know that something else is possible just by what we learned during the pandemic, when resources helped dramatically reduce the rate of economic insecurity. We saw enhanced economic security programs driving poverty to a record low in 2021. In other words, we can make policy choices that move the needle on what has been perceived in the past as either intractable or hard to accomplish, where we saw almost overnight a reduction in child poverty. Child poverty rate fell to a record low of 5.2% in 2021 compared to 9.7% in 2020. And the Black child poverty rate declined to 8% in 2021 compared to 17% in 2020. So almost by half based on policy decisions. So we think that there are a number of policy choices that we can make that help families not become overloaded, or can help offload some of that burden through macroeconomic policies that are evidence informed, increasing the minimum wage and stable employment, income equality and mobility, paid family leave, the earned income tax credit and the child tax credit, increased concrete supports. We also have studies related to healthcare, childcare, housing, home visiting, flexible funds, and direct cash transfers. Public benefits. We see when we expand or make more accessible our public benefits, reducing administrative barriers, reducing sanctions, making them more generous, we see reduced risk and offloading the burden that is creating the context in which child maltreatment and involvement with child welfare occurs. When these have not been provided efficiently, effective at the level necessary to reduce risk, we think that an economic differential response, similar to what Vermont has in place, a community pathway by which child welfare resources, community-based organizations to support families, and service navigation can ensure that families receive sufficient resources, sufficient evidence-based practices to address mental health or substance abuse challenges or domestic violence alongside economic and concrete supports, so that foster care becomes truly used only when absolutely necessary and becomes a time-limited strategy so that families and children can remain safely together and in their communities. Our resources, I think Yasmin has dropped probably into the chat, our website with the reference list to this presentation, along with an additional, more expanded slide deck and a number of tools that you can access here as well. And I'm going to stop sharing the screen, I think, for a moment and see if we have any questions or comments that folks want to put on the table, and we're happy to engage in dialogue with you all and learn, and most importantly, learn from you about the strategies that you are putting in place as part of your prevention planning and strategy at the county level. I think we are all interested in what you all are doing, so that we can share among peers here, and transfer knowledge across counties about what you're seeing, what challenges you're having, and where you see opportunities. Yasmin, are there any particular questions in the chat that we want to take on? And we'll just ask you if you want to flag one or two of them and ask the person to come off mute, and we'll just get a dialogue going if we can do that.
Yeah, we had one question from Jennifer, or comment actually from Jennifer Regariado, who's a home visitor, and felt that, hoping that the evidence that we presented today will result in more federal dollars going directly to young families. And a very similar comment by Junius Williams about how there's a need for families going directly to families, but also highlighting the disparities in racial and race and ethnicity in terms of involvement with child welfare. I welcome any other thoughts on that, as well as if Jennifer and Junius want to share more, we're happy for anyone to come off mute.
I have a question.
Yes, please.
If you, either Claire or Yasmin, were in charge of starting a prevention program today, what is the very first thing you would do?
Reorient the money.
Oh, the very first thing I do, I probably would talk to parents. I probably would show them this evidence, and I would talk to parents who have been involved with child welfare or who have averted having child welfare deployed, and ask them what they think about this evidence, and what their needs are that would be most meaningful. I think that's the first thing that I would do. Yasmin, how about you? And
No,
then
I
let's
agree.
ask you the same question.
I agree. I mean, I think that's key. A lot of times we feel that kind of our programs are shaped by funding streams. And we are increasing a lot of administrative burden on families. So something else that I think is really key is doing a landscape analysis and understanding what options you have to reduce administrative burden for families to access or be eligible for resources, because that also reduces the administrative burden for your own workforce. And we know that workforce turnover and burnout in this field is very high. And so that's something else that I would elevate immediately.
I'll just put a couple more words to that. We've been talking a lot about, and you heard us say, the need for a shared responsibility and accountability policy framework that prevents and averts the activation and deployment of child protective services and the use of foster care. And so I probably would also want to ensure that I was not going this alone, that CalWORKS, Medicaid, the legislature, that everyone really understood relative to this evidence that it is our decisions that are often a contributing factor, and that has enormous implications for how we share in responsibility and accountability for preventing and averting the activation and deployment of child protective services. Really, our upstream systems are our prevention strategy in part, and bringing our child welfare dollars to this gap in between where our upstream systems are not effectively or efficiently or creating the context in which families can access available resources or expanding resources, so that we're building this space in the middle through a really comprehensive prevention strategy. And then Linda, we'll come back to you after Jenny's question to ask you the first thing you'd do as well. Jenny.
Thanks so much. And really thank you so much for all your work in this area, because this is really important research that all of us can use. And I've seen some of it before, and this presentation was just incredibly helpful and just made me think a lot, even more deeply about the work and these findings. The one thing that really stuck out to me was the piece of research you had found with respect to mental health and the impact of lack of resources on maternal mental health. And the reason why I think this is an important next step in the research, particularly in California, is we have the recent research by Dr. Palmer and Putnam Hornstein about saying that 75% of the neglect cases investigated in California involved mental health, substance use, or domestic violence issues within that family. And so I think, in addition to talking about addressing other basic needs, providing resources to prevent abuse, I think we're going to also have to think about how do we move resources towards some of these issues that neglect also is kind of a large umbrella for. So sorry if that's complicated, but that's my statement piece of it. And then my question piece is, I don't know if you've come across or there's other research being done that is similar with respect to domestic violence and or substance use.
I know that Claire shared at the very beginning of the presentation about kind of what's in that box of neglect, and we don't fully know. I think that in a lot of ways, economic scarcity, really living on the edge, can contribute to substance use, mental health, and other family complex problems. And I think we have to kind of see it as a whole, like providing holistic supports to families and really trying to increase stability to prevent those more complex problems from really resulting in a crisis. There is some emerging research on the relationship between increased access to economic and concrete supports and domestic violence. However, it's still not fully established yet, which is why we don't have all of those studies in our deck. Our deck really includes the studies that have the strongest evidence base and the strongest and most rigorous design. But I think that's an area that we're hoping to learn more about. I will share that we know a lot from what happened during the enhanced COVID response by our government, and having those stimulus payments, unemployment benefits, increased access to all sorts of government services really was related to decreased depression, anxiety, and stress in families. Like, the correlation is very clear when you look at those graphs. So we do know there is a relationship between mental health and stress and family stability and economics. We could talk about this more, but I want to make sure that Claire has a chance to also respond, and we also see a couple more hands up, and I think we have about 6 or 7 more minutes.
Let's go to Tina.
Hi, let me read what I wrote in the chat. I'm a parent with lived experience. I just wanted to also have lived experience with domestic violence by proxy of the family policing system. So I know for a fact that perpetrators use these systems to harm families. I know there's some legislation being introduced, but my comment was, as a parent with lived experience, I would like to emphasize when seeking the input and steering of solutions upstream, to the family policing and for foster care involvement, it's vital to seek knowledge and experience of those who are most impacted, Black, Brown, Indigenous families, and also to be careful to seek out those who are not employed by the system, such as here in LA County DCFS, and because a lot of times they want to sustain their jobs and they can't speak freely. And I'm noticing a lot of that happening. And I'm not to diminish those experiences, but to acknowledge that sometimes these individuals get the spotlight and they cannot speak freely. And so not to limit anyone's input, but I would just encourage to seek out those most impacted.
And thank you so much. We concur. Liz.
Hi, thank you so much for your presentation. I'm very interested in all the research that's being done. And I just wanted to share a resource for any of you that this might be helpful to. I'm the director of a community organization called Safe Families for Children. And we are also an evidence-based program that actually had a study also at Chapin Hall. But we work to help reduce the relational poverty. And so what we see, is that it's not just the income level, but relational, when families are isolated and have no one to call on, the increased rates of referrals for calls for abuse and neglect is much higher. And so that's what our organization exists to reduce. And I just wanted to briefly share that there are a few chapters in our state, and we're seeing significant reduction in childcare or CPS placement. So just wanted to share our resource for you.
Thank you. I think that's all the questions and hands that we have. Is there?
I think
See
Missy.
Oh, okay. I'm sorry. I couldn't see that.
No, it's okay, Claire. I think kind of along the same lines that Liz just shared. I loved the presentation. I love all the statistics, like anything the data we can use to help share what we do and why we do what we do is super helpful. I think as I was reviewing the slides, I saw that, as we talked about how finances were being used and there was a decrease, it seemed, in my humble opinion, marginal, 8%, 5%. Under 10%. And not to say that those don't represent lives, any lives deferred out of CPS is great. However, it did seem that the study that had the most, had the best results, yielded the best results was the family visiting. It was like 40% and, over 10. And I think from my perspective, and maybe this is a biased perspective, but it increased that relational support. Somebody coming in, somebody, helping the mom, helping the family. And so I just am under the impression that talking about finance is always helpful to a certain point, right? But how do we continue to bolster the relationships that these families who are on the edge, how do we continue to support them relationally so that they would be deferred from CPS? I'm just curious if there's more research out there that could help us communicate that, because again, there's obviously financial poverty, but there's also relational poverty. And I feel like a lot of these families are relational impoverished. And just to give you context, I serve at Olive Crest, where we have a foster care program, but we also go upstream into family preservation through a Safe Families for Children like model. We call it Strong Families. So I'm just, is there anything more that we can focus on or steer our funding towards? So it's not just that $1,000 check, but it's also relationship.
Oh, there's an enormous evidence base around social connectedness. Absolutely. We've focused here on economic and concrete supports, given the lack of attention for economic and concrete supports as a prevention strategy. Absolutely. Social connections, relational health are a powerful tool in reducing risk and preventing involvement with child welfare. We also know that evidence-based practices regarding mental health and substance use and parenting can absolutely have an effect as well. I hope no one here walks away thinking that we are suggesting that only economic and concrete supports are the solution. It is one part of the a holistic solution that we need to ensure is responsive to, as Tina indicated, what families say is most meaningful and most helpful to them.
And I just do feel the need to just point out that we can't compare all these studies like apple to apple. Some of them had smaller sample sizes and some of them had larger sample sizes. So we can't say this one had 39% decrease and this one had 6% decrease. So that means that this model is better. I just feel like I have to just make that clear. One thing that's related to this, I was just responding to a question or comment that came up in the chat about providing direct cash to families can allow them to have more time to be involved in their communities and relationships. And I do want to say that that's a really important point, and the evidence from the many, many guaranteed income projects that have been kind of going on around the country for the last couple of years. We're starting to see the first evaluations, and a lot of them actually show that the families had improved situations and also improved connections to their communities, more time to spend with their families, and just time is so important in so many ways to families. So thank you for elevating that as well in the comments.
Stuart.
Just one, yeah, I think you all may have said this before, but just to emphasize as folks go back to lunch and the rest of their work, that in California, having CalWORKs at the table for your prevention activities is absolutely essential. I mean, this information could not be more valuable as we think about how do we keep children and families out of the child welfare system. We get them as many economic supports as we can. So just wanted to, first of all, thank Clare and Yasmin for making this presentation, but also to bring it back to where we are with the prevention convening, that it's all about making sure that families get everything they need, and especially the economic supports. It's always fabulous to hear what you have to say. So.
Thank you, Stuart. Likewise, right back at you. And I will +1 on that. And sometimes usually when we're in a live audience, I give a pop quiz at some point. And the question in the quiz is, does anyone know the first statutory purpose of TANF, temporary assistance to needy families? Anybody know the first statutory purpose? Okay, I'll give you the answer and then I'll ask you again, what is it? Relative to Stuart's point, the first statutory purpose of TANF is to provide assistance to needy families so that children can be cared for at home or with relatives. That while states are not required to implement any one of the 4 sub purposes of TANF, given this discussion, it's imperative that as you all think about your prevention plans, that you keep in mind that the first statutory purpose of TANF is to provide assistance to needy families so that children can remain at home or with families. So there you go. Looks like we got one more hand up. Kevin.
Hi, good morning or good afternoon, everyone. I'm fairly new to this realm of work. I just switched over, a complete career change, but I just wanted to emphasize a couple of things that were already said and just share my thoughts. So I wrote down that I appreciate all the information provided, and I am very new to the field. Again, the information provided was great and informative. I just want to ask, where do we go from here with it? It does provide a good scope of what's happening in our families' lives. I think that I have recognized, especially with the program that I'm with, I'm a family support liaison. And I do feel like sometimes money is not thrown. I mean, money is definitely necessary to alleviate some of the burdens that our families experience. But I do feel like sometimes it's just a Band-Aid of the issues that they're facing. And I may be completely off base, but I feel that the mental stability of the parents, especially young parents and parents that have come from broken homes or physical and emotional abuse, I feel like the mental stability of the parents is priority. And then I also wrote down that I also believe that the resources that deal with detailed oppositions that the families face is a necessity, such as resume building, time and financial management, building credit. So I get that the finances are definitely a necessity. And I know there's resources and programs out there, but I don't know if I haven't heard of one, and I could be completely wrong. Again, I'm new to this, but I haven't heard of a program where, the money is coming in indefinitely. So it's like, okay, here's a bus pass for the month, and here's a couple of people you can reach out to. Have a good day. Here's rent paid for the month. Hope that works out for you the following month. So I was trying to see, where do we go from here with all this, with the information. And again, I know there's resources out there. Again, I'm new to this, so I could just be flying over everything else.
I think the where do we go from here is the question for everyone who's attended. And we are looking forward to seeing what you all make of this information in your prevention strategies. And we are looking forward very much to learning from you over the next year as you continue to do your work. Thank you. Barry, back over to you, I think.
Yes, we are at noon, so it is time for a lunch break. We will return back here at for the second set of workshops at 12:35. So you should go to the landing page that you came to at the very beginning. And if you should be able to sign in from sessions from there. Any problem you have, you go to the 3 lines in the upper right-hand corner, and you should be able to see the sessions by clicking on that first. So thank you so much, Claire and Yasmin. That was wonderful as always. Super inspirational. Really appreciate all that you brought to this work.
Thank you all. Stuart, it was good to see you. Thank you for being here. I agree.
Oh, no, always, always learn so much. Feel like we could get some college credit for listening to all that good information.
It's a
But
lot.
not that I actually need another degree, but old dogs, new tricks. Anyway, how are you?
I'm
Otherwise-
good. I feel like an old dog with new tricks.
Well, I'm always the oldest dog in the room, so.
Well, it's always a pleasure to see you. I'm honored that you are here. Thank you.
Oh, no, it's great. Such great information. I was going to do a plug for linkages as well, but
Yeah.
I think you did a good plug for linkages. And actually, I don't know if you were there when Kim Johnson was going through her things, and in her welcome, she mentioned linkages. So
Good. Terrific.
and the work that they're doing for families. So
Fantastic.
anyway, I think safe travels, but I assume you're at home.
I am. Thank you. And tell Dana I said hello, please.
Yeah. She just had some medical stuff going on. So
Okay.
otherwise she would have
Send her
been
my
here.
best. Send her
So-
my very best.
Yeah, she's on the mend. So anyway, great to see you.
Likewise. And Barry, do you need anything from me?
I don't think so. I think you dropped the link and we have the presentations. So we should be good. If we need anything else, we'll reach out.
You know where to find me. Thank you so
Yes.
much for including us.
Thanks so much
We're
for
really
doing this.
grateful. All right. Take care, everybody.
Take care.